and welcome back to Let's Talk with Parul. Get ready for yet another conversation that really needs to happen. And this one is about respectful care during maternity. So descriptions about childbirth, they range from all kinds of feelings, from exhilaration to empowerment to spiritual, right down to excruciating, tough, exhausting, etc. But those conversations often overlook a very common reality, and that is disrespect and indignity. Violation of a woman's basic right to respectful care during childbirth. So, to help me understand and to explain what respectful care during maternity means, we have two guests who have vast experience in this field, the skills, their hands on experience, which they're going to be sharing with us. Please help me to welcome Ruth Malik and Neha Misra Mutluru. Thank you so much for joining us. Let me give you a little introduction about them. Ruth is the founder of Birth India, a postgraduate in public health, a doula, a hypnobirthing childbirth educator, and clinical lactationist. And Neha is the founder of Birth Sense. She's a certified childbirth educator and birth doula, and also runs the Delhi Birth Network. Thank you so much for joining us today on Moms Wrestle.
Thank you.
So now both of you have vast experience, like I said, and you have probably experienced that entire range of feelings that I was talking about, from exhilaration to excruciating pain and all of that. So where in this entire spectrum does a respectful birth feature? And what does it really mean? What do we mean when we say respect during maternity and maternity care? So Ruth, maybe we can start with you.
Well, when we talk about the treatment of women in a respectful way, it is actually enshrined in the law, whether it comes under the Human Rights Act or the Consumer Protection Act. So we're talking about things like safety, autonomy, justice, basically the right to be treated with dignity and privacy. And all of these are absolutely, definitely laid down in the law for women to be treated with respect.
And the right to have information and to be able to make informed choices and not just be told what to do. So that's at the heart of respectful care.
So all this, like you're saying, is a constitutional right virtually. I mean, it is, when you said it is a part of your human right and consumer right, this is something women should be able to ask for.
Yes, and if violated, they can actually act upon.
So in the context, I'll ask you to break it down for me a little more. In the context of a hospital setting when a woman has gone for delivery, what exactly does this translate to?
So I would say, first of all, the fact that she's treated with respect. So she is an individual with autonomy on her own body and her own health. And she has come to seek care. And offering her information, telling her about benefits, risks of any procedure being offered, asking her what she thinks and what she feels and what's her opinion and where she's coming from and what she needs, and treating her with that amount of dignity is the basic of respectful maternity care. I mean, that's what it is for me. Do you want to add something to that, Ruth?
I guess if you want to clarify it, the opposite would be coercion, abusive language. You can even be in a situation where you could be slapped, forced to lie down when you need to move. You know, the freedom to birth, the freedom to do what you need to do for your baby. So I think that sums it up.
So now this rings a bell, and I'd like to share my own birth experience because I think it just fits in very well in this particular conversation. So I was induced and asked to get admitted into hospital on Wednesday night, for example. And Thursday, all day, I was in bed, immobile, strapped to 3 or 4 monitors of various kinds, of fetal heartbeat monitor, a BP monitor. I had an epidural running, so I was probably, stationed in one place. And it was basically, even if I moved a little, one of the alarms would go off. And I was scolded, like you said, now maybe not abused, but it wasn't a good feeling. I was scolded at that time and I was told, I was made to feel as if I was judged because I was moving around. So are you not caring for your baby that you're moving around so much? I was on my back after months of being told that lie down either on one side or the other.
So the important question here to me then is, how did you feel? How did that make you feel? Because it's not about as much about what happened, but how you were treated. Did you feel like something was not right and you weren't being heard and
Absolutely.
what you needed wasn't being offered to you. Or you could also feel it could still be an induction or a cesarean or whatever, but you could feel like you're doing this because you know this is right for you and you know that you've made the right choices, you've been given the right information, you have been informed about what's happening. So that is the difference
I think
between
in my
respectful
case,
versus.
you're right. But in my case, I think it was a little more about the fear being set in, that if you do not lie straight and move too much,
Yeah.
then your baby
So
is
the
going to be
fear
in
is an
danger.
outcome of the way you're treated.
Right.
So if you're treated respectfully and you feel safe, then whatever is it that needs to happen happens very differently
Very
for you in
organically,
your
right,
experience
right.
versus
Right.
you not being given information, being told this is what needs to happen, and so you're afraid. And so what's going on in your head can be very different. I'm not even getting into here the induction
Absolutely.
and the procedures.
Right.
That's a different discussion altogether.
Yes.
But just the way this information is presented to you, the way you've been spoken to about it, the
Yes.
way you're treated by the
Right.
staff, by the doctor, by everyone around, is what makes the big difference.
I think also the fact that you didn't feel safe. When we talk about safety in birth, we often
Yes.
get stuck on infection rates and, keeping everybody alive and healthy. But if you don't feel safe, you are in fact not safe. And if our human rights are not honored in childbirth,
Right.
women are actually not safe. It's a part of the package. It's not just about the medical aspect of it.
That's right. So it's a fact that, of course, all the medical facilities for maternal health have increased. They have reached many, many more people. But perhaps somewhere in that process, the experience has been forgotten. Do you feel? Because
Yes.
it used to be unattended birthing at some point of time. And of course, that wasn't the safest.
Yeah.
There was a very huge maternal and fetal mortality rate at that time. We have managed to control that, but the experience is lost, is
Yes.
completely lost.
So, I mean, it's a global problem now that's being
Yes.
talked about
Yes.
globally. And we know that at the time of birth, women are at their most vulnerable. It's the time where women are at a risk of mental health illness, at the highest
Right.
chance in their life.
That's right.
So how they are treated as they step into being a mother is very, very important. The experience is very important for the emotional going forward of both mother and child.
And this is something that is science. So how you feel and
Right.
what's going through in your mind impacts your nervous system, it impacts your endocrine system,
Right.
and it therefore impacts every cell in your body. How your organs function is directly linked to how you're feeling.
How you're feeling.
That depends on how you're treated. So if you're treated respectfully, you actually do have most of the time a much better birth in terms of even the outcome, the health outcome.
Right.
And with the baby too. I mean, it affects.
Yes, of course. It has to be both ways.
Absolutely.
Mother
So the
and
baby,
child.
so the baby in the womb and after being born is, now we know scientifically as well, is a conscious sentient being and is aware of the environment and is
Right.
constantly seeking from the environment a sense of safety. So if the mother is feeling safe and positive and empowered, she's going to transfer those feelings to the baby,
baby,
and
right.
that is going to affect the health of the baby. Babies thrive in an environment where the mother is respected and feeling safe, because that's how they feel then. But if
Right.
the mother is threatened and the mother is made to feel afraid, that passes down to the baby, and it actually puts the baby into a panic mode, into a state of trauma, and causes health. There's a
Impact,
a direct health
Yes.
impact of that experience.
In
So-
fact, that's exactly what I wanted to ask you about. That is it just a one-time thing? Do I leave the hospital and forget about it, or is there
Absolutely
an
not.
impact?
I
You
mean,
mentioned,
we know that women who have good birth experiences are more likely to breastfeed.
Yes.
And there's less chance of postpartum depression. We also know that high levels of anxiety in mothers are causing things like colic and, very restless,
Babies.
upset babies who are crying a lot.
Right.
So
And
it
that
has
anxiety can,
very physical impacts
physical.
that go forward into the entire life.
And it
it
your
sets in
child,
then.
absolutely, your childbirth experience sets you up for parenting. So it is a rite
Right.
of passage.
It
and
is.
how you experience the process of nurturing and giving birth to your baby is
Right.
preparing you for parenting. So if you've had a good, positive, empowering experience, you'll be a confident parent. You'll be able to take on challenges that are
Absolutely.
yet to come a lot more easily. But if you start off with being afraid and being told that you're not good
Yes,
enough
yes.
and you're not capable,
You're already judged. The
that's
baby
the kind of
hasn't
parent you end up
arrived.
becoming. Absolutely. So it's
Right.
not just about what happens in those
Yes.
24, 48 hours. It stays with you for life.
Yes.
It's a function of your relationship with your child, and it impacts that at every level.
Ruth, you had an experience to tell us with your own children.
So I think after my first child, I was suffering high levels of anxiety and maybe not postpartum depression, but we were getting there. There was a lot of sleeplessness for both of us. He was a very bad sleeper for many, many, many years.
Right.
And he was a very hyper child. And I was beginning to think about things like, does this kid have ADHD? What's going on? Then I just decided to get myself some help. And within a matter of days after reaching out and getting some help and being heard and kind of calming down, I saw my son change. So you can definitely overcome these things. You can do a lot to help. I had a lot of difficulties breastfeeding, but I pushed through them because I knew at some level that was going to heal both of us, and it did. But by the time he was about 3, I definitely needed a little bit more help. And it's something, my son is 17 now, and we still kind of touch in with these feelings at times. It's a journey that we both go on. He was kept from me for 24 hours for no reason. He was perfectly healthy. It was just a hospital policy. And it actually destroyed me that my son was kept from me for 24 hours. It really, really put me in the wrong place. When they gave him to me, I was disassociated. I was like, this is not my child. I need to go home. I need to come back and do this again. There were very, very scary feelings that I had as part of that experience.
No, and while, this is something that is an obvious sort of disrespect, I would say, but there are a lot of subtle things which sometimes you don't even know about. Just this comment that a nurse or a radiologist or someone would say that puts you down and makes you look at yourself like you're not capable or you're not good enough. That's bad enough.
And there
it's
is
similar
that
to your story where they're telling you to lie on your back where you want to move. They're saying you don't know what you should be doing.
And obviously
like
there
you're
is
a
some
child
instinct telling me that I should be up and about.
Yes, and you're about to become in charge of another human being. So you need to be given some confidence about that
and
job,
respect that you know what you're doing and you're capable and you will make the right choices. If that's acknowledged, that goes a long way in your parenting journey.
Like you said, that's so fundamental. I mean, one doesn't look at it in such a deep perspective, but really it is a building block.
It's very deep.
It
is the most deepest experience of a woman's life. It's a very deep thing.
And we want it to be memorable. We want it to be, of course, all those words come in, exhilarating, spiritual, amazing, and all of that. And it doesn't. It's a huge letdown. I mean, I know both my experiences. I was feeling a little let down. I was feeling a little shortchanged. That is this what the whole, delivery, birthing, childbirth experience is meant to be? Just to put the conversation in context, April 11th is observed as National Safe Motherhood Day in India, an initiative put in place by the White Ribbon Alliance India in association with the central government. And the objective is to advocate quality, respectful maternity care, as well as, of course, safety. That is primary, of course. We ran a poll yesterday on the occasion of National Safe Motherhood Day. We ran a poll on our Facebook page. A lot of you have answered that already. We just wanted to understand from the mothers on Momspresso what the childbirth experience was like. And we asked you a few questions. We asked you if you were informed properly about procedures, if consent was taken before the procedures were performed, were your birth choices respected, was a companion permitted to be present with you during childbirth, were you allowed skin-to-skin contact, were you allowed to breastfeed the baby immediately at birth. We have a staggering response of about 35 people, women, 35%, yes, who have said that no, mostly no's. Most of the answers to these questions were no's. So I think that's a huge, huge percentage of people saying that they did not have a pleasant, respectful birthing experience. That's nearly 1/3. 1 in 3 women have acknowledged that. And of course, we've just skimmed the surface. These are 5 basic questions that we asked. The questions go much deeper, like the sample questions that you were giving us earlier. You were giving us an idea of what all this comprises. But Ruth, what do you think? What does this indicate? This huge percentage of people saying that no, we've not had a pleasant or a respectful birthing experience.
It's both sad and also promising because when I started about 13 years ago, most women, it was not on their radar. They were just healthy baby. They were not in touch with how they were feeling about it.
Right.
So it's promising that women are realizing what is respect of their autonomy. But the next step would be, what do we do about it? Because it's very sad. And the numbers are pretty much aligned globally. This is not an India problem.
Right.
But, I would hope that these mums, it's really very simple to write a letter to your hospital about how you felt about the experience, or to the local medical authority or your local parliamentarian. And I would really hope that women would start doing this. The only changes we have ever had in maternal care which have been positive, for example, your husband allowed in the delivery room, or now we're seeing increased rates of babies being put direct to breast. These have all happened from consumer awareness, from mums pushing for it. So we just, if we could get more people speaking
just ask
up,
for it.
yes,
Right.
and to make a complaint when it doesn't happen.
Right.
So a lot of these things also exist in terms of protocols and therefore rights that you have.
Right.
But a lot of people aren't aware. So there are moms who say that, my husband wasn't allowed and that's the rule in the hospital.
What can we do about it?
What can we do about it? But
Right.
that's not true. The
So
hospital is supposed to, it's mandated that the hospital allows a birth companion with you at all times.
Yes.
So there is also somewhere, I think a lack of awareness in terms of the things
for
that
sure.
are my rights and that I
Right.
can ask for. You do have the complete right to ask for all information about any procedure. It is not
Right.
okay if your doctor tells you that I just know this is good for you and just go with it. No, you have the right to understand what is
Right.
this procedure, what are the benefits, what are the risks, do I really need it,
Right.
you can completely ask for that information. So there's somewhere also, and which is why we're doing these conversations, because people
Yes.
need to know what are their rights and that you can rightfully seek this information and seek this kind of respect from your care provider.
Right. We've had a lot of responses, of course, along with the poll. We've had a lot of women sharing their birth stories, and it's quite heartening to know that most of them have had a good experience. They say that Sonanda says that she had her delivery in Germany, and she says it was extremely memorable. Everywhere she went felt special. She was pampered. Swati mentions in India, her doctor was very supportive, explained everything in detail. So that's the kind of basic courtesy, I would say, we demand from our doctors. That just tell us what's going on. We're first-time mothers most of the time, of course. When even the second time around, you're not an expert.
New every time.
The story is new, absolutely. So good for Swati. She says she missed skin-to-skin contact immediately, and she breast both her daughters 3-4 hours later. Bharti had a similar experience. She says supportive gynaes and doctors regular checks were going on. So she was not conscious, she says, because she had a C-section, so breastfeeding was not possible. And I think in that kind of a stage, again, it's all right. I mean, you don't need to, as long as your doctor has explained it to you, if you're aware of the facts.
So I just want to say something here, that while I'm glad that a lot of people do feel that they were supported and felt positive, somewhere also I'm sure that there are a lot of women who don't think that what happened was something that they need to question. And they may, they believe that this is how things are and I have to accept it. Right. And even though somewhere intuitively they know that it could have been better or I could have been treated better. So I think it's really important for women to acknowledge that intuition and that feeling. And if you are, because a lot of the times you're just told what needs to be done and how you need to behave and how you need to speak to to elders and to superiors and to doctors.
We
and
live like that.
We live like that. We're in a society where this hierarchy is so deeply entrenched that a doctor is someone who is superior to you, and so you're supposed to respect them. And I agree. Yes, you do respect them. But it is not about disrespecting the care provider. It is about realizing how important it is for you to be treated well and to seek information. So somewhere, if you're not feeling that there's something not right, I mean, intuitively, every mother, when the baby is born, you want the baby with you. And so if you're not getting the opportunity to do skin to skin, you know something is not right. But then everyone around you is telling you, no, the baby needs to be observed and the baby needs to be cleaned and the baby needs to be injected and all of that. I would say speak
Speak out.
out. If that's how you're feeling, just speak
Right.
out, because there is something to
there
that.
are providers even in C-sections that are putting babies direct to
Yes.
breast.
Yeah.
There is, and the pediatrician is assessing the baby at the breast.
Yes.
So, the providers are all very, very, very different.
Yeah.
Right.
So it really is up to the consumer to learn about what is evidence-based practice, what is safe practice,
Absolutely.
Right.
and then to interview their doctors
Right.
and find the one that's matching what they would like to happen, because they are all very different. It's not a standardized practice at all.
Absolutely.
And this
And
is work
we
that
can see.
you should do before. This is not
Yes.
about making the birthing process into a battlefield and you're fighting for your rights while you're in labor. That's
No.
not the point.
You're not,
Yeah.
probably not going to be in that frame
Exactly.
of mind.
So you do this in advance. You
Yes.
think
Right.
about when you're pregnant or when you're planning a child.
Right.
Think about the kind of birth that you would like to have. Do your own research. Find people who will help
Accordingly.
you. Find
Yes.
interview care providers. It's literally like shopping. I
Yes,
mean, you
right.
buy
It
a
is.
car and you
It
will
is.
go
Yes,
to multiple showrooms and test drive, but
Yeah.
why not with your care provider?
Absolutely.
And you find someone who is in sync with your philosophy of birth, who listens to you.
Right.
That is when you're setting yourself up for a good birth.
Yes.
Absolutely. Ruth, you had a question, a comment about that, even at a later stage, don't feel scared to change
Yes,
your service
a
provider.
second opinion, third, fourth, fifth opinion is,
Don't worry about
it's your right. You don't, there's a difference between respect, but also you are number one. If
Right.
you need to walk out of that surgery and go and find a second opinion, even on your due date,
Go ahead
you
and do
can
that.
go ahead and do that. If you want to change a doctor on your due date, you can go ahead and do that.
So
Just
listen
deal
to-
with that doctor later.
Yeah,
It's okay,
Yeah. And listen to that instinct, I
Yes,
guess. You've
yes,
spoken about
yes.
a gut feel that every
Mhm.
woman has.
You need to be with
So-
someone with whom you feel safe fundamentally.
Yes.
And if something is not right in that equation of yours with your care provider,
right.
it's
Go ahead.
go ahead and do something about it, or be okay with it then.
Yes.
and,
Right,
and
right.
accept it and say, okay, I trust the doctor and I trust what the advice that this doctor is giving me, and go with that. So be in one of those
One of
is
those
what I
traits,
believe.
absolutely.
Either act on it
Right.
or embrace it. If you're stuck somewhere in between, it's going to be hard.
Very true.
I'm going to ask all of you to share your stories. Tell us what happened during your childbirth experience. Was it anything that we've been discussing over here? Was it over and beyond? Was it the exhilaration you were expecting? But do share. Whatever happened, please do share. We'll discuss it right now. We'll bring out points. Maybe you'll be able to help another mother who's going through a similar situation, who may not know quite what to do at that time. But when we discuss, when we bring out these stories, it's only then that you become aware of something which is a basic right, like you said. So Nikita has a question which is in continuation to what we were saying. Nikita wants to know, how can we make sure that babies are given skin to skin, are not fed formula in the hospital? That's another thing. All my babies, both of them, were fed formula, and that was because I really feel I was not given a chance to
I think-
breastfeed.
Firstly, you need to find out if that is the hospital practice. And if it's
Okay.
not, that's not the right hospital for you. You need to find out if the practice is direct to breast. You need to find out so why they're giving formula very often is that they have concerns for different things like weight loss and hypoglycemia. So you might want to ask the doctor, when do you intervene with formula? Under what conditions? And then check, are you comfortable with those conditions or not? You can make it very, very clear that this is something I do not want to happen. We've had a change.org petition recently where they actually want it to be law in India that you have to consent for formula. So it is a very serious issue that mothers can definitely take up with their birth
So
providers.
there is a lot of awareness about that
Yes,
already.
yes.
Yeah.
And then I'm going back to what I was saying earlier. You do this before. So when you're
Yes.
choosing your doctor and your hospital, like we were speaking a while back, you actually not only interview doctors, but you speak to mothers who've been to that hospital or the
Right.
doctor and ask them what was their experience like. So then you really know what
Was
you
your
can
baby
expect.
given formula? That's
Yes.
what you want to
Exactly.
ask other mothers.
Yeah,
and if
that's
they're
true.
saying yes, 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 that's not the hospital for you.
If that is what you want. I mean,
Yes,
is
that
what
is
you
that's
want.
what your
It's all
goal
about
is.
what you
It's
want.
what you want.
What matters to you.
Right. If it
Yeah.
is not high on your priority list, fine. Whatever your gut feeling, your comfort factor goes with. What about separation from the mother? Is that something we can question?
Yes, you might want to ask. It's very rare these days that they're putting babies in what they used to call it
Incubator
a maternity
or-
room. But unfortunately, the NICU has become the new baby room. So they're often saying that, oh, your baby was C-section, so it has to spend 3 hours in the NICU. You're being charged for that time in the NICU. It's often just a matter to make some more money. Too many babies are going to NICU now who do not need to be in NICU. So you need to ask, under what conditions do you put the baby in the NICU? Do you normally let the baby come direct to breast? You just need to ask what their practices are.
And what I understand from this is the minute you ask questions, the doctor and the support staff also know that you're aware.
Yes.
They're not going to fool around with you even. Unfortunately, a lot of hospitals do have that.
In fact, that was something that was on my mind. One is what the hospital does as a typical routine procedure. Two is what have you asked for? So if you are, clear on these are the things that are important to me and matter to me, and inform your doctor in advance that this is how I would like my birth to be, whatever be their routine procedure. If they are really listening to you and what you say matter, they will go out of their way to do that. So I have seen a lot of mothers going to a conventional hospital that doesn't do skin to skin by routine, but because she has specifically mentioned that I want my baby with me, I do not want my baby to be separated unless there is a very specific reason which I should be informed. And they do that then by request. So it's both. One is finding a place that does this routinely, or if you can't, then you speak to them in advance and request them and talk about your preferences and what matters. This is what I want. And they should listen to you. If they are not listening to you in spite of that, then that's a big red flag.
That's when you need to go somewhere else. If they're being hostile towards you when you ask questions, this is not the right place for you.
Right. There are some lots of more stories coming in, and before I share that, I have one question about a term that we've been hearing lately: over medicalization of birth. Medicalization is important. We need that for the safety and the well-being of the mother and the child. So at what point does it become over medicalization, and why are we worried about that?
I mean, today we have, many interventions, many medical interventions that can save lives, and we're very lucky to have them. But they are being misused and they are being overused. If we look at our C-section rates, they are way above what's required. India also tends to have a bit of an obsession with episiotomy, which is now almost, very low in most other countries. So we do need to look at medical intervention and when it's helpful and when it's not helpful. These are questions that you can ask your doctor. What is your C-section rate? It really shouldn't be above 15%.
15%.
Yes. What is your episiotomy rate? It should be around about 8%.
And we are given to believe that an episiotomy is required, otherwise you will not heal and you will have a tear and a laceration and I don't know what else.
So, I mean, this is how the doctors are trained. It's really important then to find somebody who's comfortable supporting your birth without these interventions, because they're not all comfortable with it. They're not used to it. They don't really have the skills for it. So you can't force upon a doctor something that they're not proficient in.
Right.
Also, I think while it's true that there is an over-medicalization and numbers show that, my view on this is also that every birth needs to be looked at uniquely. It's different, and it's and therefore you need to look at where you are at and what it is that you need, and it's not about what the numbers are. As far as your birth is concerned, your birth is your birth. It's 100% for you.
Absolutely.
Exactly. So you need to find a doctor who agrees on your philosophy of birth. So if you do believe that natural birth is the best for me and the least amount of intervention is what I want, that's the kind of care provider you find. And then you talk about these interventions and when they are and if they are needed to be used, when that will be. And so it's a very customized, specific. It's not that, I don't want an induction or I don't want an episiotomy, because all of these interventions have a role and they are to be used when they are to be used. The point is, when is that? And that is different for everyone.
Yes. I think as consumers, we often are like, I want, I don't want, I want, I don't want. We're used to shopping like that. But this is more about under what conditions would I need or would I require? And then listen to that and then go away and even read up more about that.
Sure.
Because I mean, every single birth is unique and it has to be looked at like that. You cannot apply a template and say that this is what will happen and needs to be done.
So we have a support group which supports expecting mums. And a lot of questions are coming in from there as well. I'll just read something which has been posted on Facebook right now. What about women who cannot afford private hospitals? Who respects their needs? So obviously, this is another world. The government hospitals is a totally different world. I think a lot of our experiences, the stories that were shared so far, would have probably been in private facilities.
Yeah.
But the world outside is not so great either.
So I think on one hand, yes, the fact that government hospitals are overburdened in terms of the ratio of doctors to people coming in, they do have a lot of issues, and a lot of these respectful care, there are a lot of issues with respectful maternity care. Having said that, from what I know, there is an acknowledgement of this, and the government is doing stuff, trying at least to do stuff to change things. There is the Lakshya project, which is to actually change labor room practices and improve the way birth is treated in the labor ward. There is the White Ribbon Alliance is working with the government and doing stuff to, introduce respectful maternity care. The government is looking at bringing in midwives to support women. So there is stuff going on. I'm not the best person to comment on that because I don't understand it. But it's encouraging that at least there is an acknowledgement that something needs to be done to improve. Yes,
and their procedures and protocols are actually quite incredible. They have delayed cord cutting, direct to breast, delayed bathing, and in not always are they following them, but they have a really good standard. That's the basis of the practice.
Promotion of breastfeeding also. There is the national campaign.
That's a huge campaign.
That's a huge campaign. So there is stuff being done. Now, how much of that is translated is another question.
But the intent is a great place to start, I would say.
I think if you look also at a lot of the questions of what women want, that campaign, it's mums in the government hospitals who are saying things like, I don't really want to share a bed with another person. It was a bit dirty. I want a clean toilet.
Level.
They were rude to me. They called me a beggar. It's a different level. It's, there's kind of abuse and disrespect of women who have money and access, and abuse and disrespect of those who do not.
A different set of problems in both the worlds, but the problem of respect is there in different ways.
That is universal
in both the worlds.
And that is, again, we come back to that fact that it's a basic right.
Absolutely.
And every mother just needs to have it
and
at
this is
any level.
Justice. It's your right to justice. It doesn't matter your economic background. You have a basic right.
I'm just going to read out Vandita Chaurasia's story. She had shared this with us. She had a bad experience with one doctor, and she says, my health was very bad. I had to choose another hospital. So like you said, she made that choice. Then my C-section delivery happened and birthed a lovely son. The second doctor was very supportive. So this is obviously very close to full term. So if she's made that choice.
I think the beauty is that, yes, there are problems, but there is always a way to find what you're looking for. Definitely. I mean, that's something we see all the time in our work, that women who are motivated to own their birth and to find the right care, and it's not about money and how much you can afford. At every level, at every level, you can find the right kind of care for yourself if you really own your experience and not hand it off to somebody else and say you take care of it. That starts with that. I mean,
so I think that mentality that we are put into, that the doctors know what's best for you, so now pipe down and just let us go with the flow. That has to change at some level. Be empowered, be aware. And
I always think of this and sort of explanation that I heard once from Divya, in fact, that so the way the system is right now, there is a hospital, and within that you come in to give birth. So your birth is a small little thing in the entire medical system. If you just flip the view, where this is me, this is my life and my health,
and my life is going to change.
A hospital or a doctor is coming in to help me. So if you can flip that view in your head, things are going to be very different.
And that's fabulous. You're not going in with an illness. No. You're going in to give birth. That is what bothered me the most.
Yes.
That, I'm being treated like a patient. I'm being strapped on all sides. I'm on monitors and everything.
Birth is not an illness. It's not an emergency, and it's not a medical emergency.
And it's not meant to feel, you're not meant to feel disempowered. You're actually in a good birth. You feel so empowered. You feel like it was the most intense and empowering experience of your life, and you feel
Right.
so confident to be able to take on this role. That's how
Absolutely,
the design
yeah.
of nature is.
So
If we let
also
it
women
Right.
who've had empowered births, they'll tell you even at, even at the age 60, if they're having a difficult situation in life, they will sometimes go back to that moment and remember that strength, and it will help them through their challenges.
Because it is an
This is what we
incredible-
need mums to have access to,
Right.
that strength. But you mentioned something very interesting, and I'll just say that when we talk about respectful birth, we are talking about women-centered birth and family-centered birth.
Yes.
The focus is on the mother and the baby. It's not on the nurse's needs, the doctor's needs, the
Yes,
hospital's needs.
yes.
It's focused right down there with mum and baby.
So if your doctor's going on holiday and wants to schedule your C-section a week before it should ideally be, question it.
No, and even simple things like I've seen instances where a mother is birth companion is asked to leave the room because they need to come and clean the room. And so they want everyone to step out. Is that more important, or is the mother having continuous support more important? So that is something you need to be clear about. You don't have to adjust to suit the needs of the cleaner and the security guard and the nurse and whoever else in the hospital, because they're just doing so you have to be able to stand up for what is important to you.
Right.
Yeah.
I've just got a new baby. You can clean your floor later.
Yeah,
Absolutely.
Baby
This
takes
is a brand new, my baby.
Yeah.
What's more important?
Right. So here's another story which again reflects the disrespect part of it. And here in terms of information, Nikita says she had a preterm C-section delivery. I wasn't informed about the procedure at all. Had no choice. No companion was permitted. But yes, I was allowed skin-to-skin contact just after the birth. So well, give some, take some.
Nice. Yeah.
But the very fact that you're not informed about the procedure, no consent is taken. At some stage, they would make whoever's standing outside sign those forms without really explaining things. That is unfortunate.
That's really sad. I mean, you
Right.
should not have to look back at your birth experience and think that I wish I had been told. I wish
I had asked.
I had asked. That you carry that feeling with you for the rest of your life.
Some regret stays
And-
for sure.
Yeah.
Kriti also had a similar experience, but it was a little different. She says she had a C-sec, was lying down for 24 hours, wasn't asked to breastfeed by the nurses, but when the doctor came, she kind of yelled at me and the nursing staff, which was too much to take for a woman who had just given birth and was judged for not feeding the baby immediately.
Well, again, that's what we're saying. The focus isn't on the mother.
It's not on the
This is a doctor now saying, nurses, you're not doing the right thing. This is, she's not thinking about the mother in that very vulnerable situation.
And you said judged. That reminded me. Women are judged
constantly,
all the time.
Yeah.
In any case, irrespective
In
of
any
whether
case.
you're in, in any case, and more so when about motherhood.
Right.
So these comments by people that tumse to nahi hoga.
Right,
A
right.
nurse coming in when you're in labor and telling you, I don't think you're going to be able to, cope with this. Take an epidural or go for a C-section. The damage that one comment can cause. We've been speaking about that.
Yes.
I mean, these small things really, really make a difference. And it's really important for everyone working with mothers during childbirth to be very conscious of this. So, I mean, hospitals, any care facility should really sensitize their staff in terms of language, the things you say, how you behave, it really makes a difference. I hope that happens someday.
This is a long-standing culture, like I said. I remember my mother telling me stories of the military hospital where she delivered, me at least, and where she says that the nurses were yelling at the moms who were screaming in pain. They were
Chup
labor
raho.
pains. Chup raho,
Awaaz kar
why
raho.
are you crying now? So, all of those things are just not right. A lot of it obviously is still there and it's not right again. It's something that
you
one
can
should
see
speak
it's
up about.
normalized in women's life from being a little girl. So we kind of have to change the way that we are speaking to women in all aspects. Quit the shaming, quit the blaming, quit the criticizing, the judgment.
Every mother always wants the best for her baby, and she will choose the best when she knows how to choose better, when she's given information, when she's given choices. You don't give her information, you don't give her choices, you force her to choose something and then you judge her for that. That's
absolutely like you said. It's the fundamental time of your life, of your bonding with your child, and it's got a lifelong impact. That is the way. That is the first place to start. Respect and dignity is a basic right, and that is also a great note to end this session. And thank you so much, Neha and Ruth. Thank you so much for joining me.
It's our pleasure.
The information that you have given, the tips you've given, it's just an awareness exercise, of course, but we hope it's going to percolate down and help the next expectant mother who goes through a situation like this, and make sure that nobody takes it in any longer, and you ask for what is your right.
Yes.
Thank you so much.
Thank you so much. Thank you for having me.